Hi, everybody. Thanks for joining me. My name is Jessie Shipe, and I own Mindful Mentor Behavior Consulting. This is a newer company in the Northern Virginia area that has a unique approach to helping pets with behavior problems. My goal is to work directly with primary care veterinarians as well as the clients so that we can all be on the same page in supporting the full mind-body connection as best we can. So at this point, we're basically considering that the mind is the body. All things that cause stress and anxiety and emotional upheaval are going to directly influence the body and its ability to function normally. So there's a lot of body systems that can be impacted by chronic stress in both people and pets. And then there's the ongoing communication between all of these different things. So it can be really, really difficult for us to effectively diagnose and then treat. So from a medical standpoint, behavior problems definitely impact our ability to do our job as veterinary professionals. But even from a social standpoint, behavior problems definitely get in the way of that human-animal bond. So ultimately, the human-animal bond is the glue that keeps that pet and that pet owner together in a relationship. Without the human-animal bond, there's really no reason to keep an animal in the first place. Behavior problems are absolutely going to put tension on that human-animal bond. Therefore, behavior problems are a huge reason for relinquishment. So in this discussion, we're going to take a look at what exactly is behavior medicine, what are the different aspects of therapy. You're going to learn a little bit more about me, how my company works, and then what are some of the next steps you can take to work on teaming up and collaborating with me. So first off, what is veterinary behavior? So the primary role here is treating animals with legitimate behavior disorders. But there are some other things that we do in veterinary behavior. We use the knowledge of normal behaviors to help set up happy home lives. But we can also use that to help troubleshoot nuisance behaviors. And then finally, those of us that have really strong backgrounds in animal behavior have unique ways of approaching the question of, is this problem that we're seeing, is it related to emotional or is it related to a physical problem? From there, we can also use knowledge of learning theory and psychology to help implement low stress handling techniques. Finally, we have a lot of knowledge about human behavior because not only are we ultimately trying to change the pet's behavior, but we have to change the human's behavior in order to achieve that goal. So to talk more about the primary role of veterinary behavior, again, really what we're trying to do is implement treatment and therapy for animals that are experiencing behavior problems. And so this list here, the aspects of behavior therapy, is something that I can discuss in a lot more detail in another lecture. But just to give you a quick overview, these are the different things that we have to take into account when we're treating animals with behavior problems. So the provider, who runs the show? That's me, Jessie Shipe. I worked in general practice for a really, really long time. I started in veterinary medicine when I was 15. I've done some time in a lot of different specialties, but I spent a long time in behavior specialty. I did a little stint in surgical and then some critical care as well. As far as getting into actual behavior, this is sort of my career timeline. I'm a licensed veterinary technician in Virginia. I have my veterinary technician specialty in behavior. I have my training certification, and then I have my Fear-Free Certified Professional Elite level. And so being in the behavior realm for so long, I have close relationships with all the big players in the Virginia area. So Dr. Leslie Sin was my instructor in tech school. I took my own dog to see her before I really got into behavior. Dr. Amy Pike I've worked with for almost 8 years at this point. Getting away from me personally and more to the actual company, as of right now, I have 3 main types of services. So the first one is what we're calling the treatment option counseling. So there's no paperwork, no summaries. It's basically just the family gets on the phone and talks to somebody for 30 minutes. My next appointment type is what we call preventative behavior counseling. So these are going to be for animals that don't have really significant behavior problems. These are more nuisance issues. But then the big meat and potato service that I have is the behavior problem assessment. So my true talent, what I absolutely love doing, is working as that sort of liaison between the client, the pet, and then the veterinarian so that we can all make sure we're using our talents to the benefit of this family. So there's kind of 6 steps in the behavior problem assessment. So to start us off, step 1 is you have to diagnose there being an actual problem in the first place. You as their clinician can then say, no, I definitely think this is a behavior problem. Here's your diagnosis. And now I'm going to refer you to somebody else who can give you much more detailed help. So now that you've decided there is a legitimate behavior problem that needs addressing, From the client's perspective, they have a few options. So first, we can always refer these guys to a force-free trainer. If you have a really, really severe problem, like those are things that really should just go straight to the veterinary behaviorist. And then there's me, who's kind of in between the two of those things. If you ultimately decide that sending your client to my group is going to be everybody's best bet, you should already have some of my business cards. If you don't, email me and I will get you more. But there are going to be little check boxes on the back of it that tell the client specifically what type of service you think they would benefit from the most. And the QR code on the back will take them directly to my appointment calendar. They can schedule online. They don't have to call and talk to me if they don't want to. Once we've referred the client, go ahead and email me your medical records. So next, we start getting ready for the initial consultation. As of right now, all assessments are conducted virtually via Zoom. And then down the line, we'll start talking more about, okay, do you need us to come into your home to really start working on some of this training? So some of the educational things we talk about at the initial assessment is again, really why these things are happening. I want families to recognize what is happening, why it's happening, and that's really going to improve that human-animal bond, which is ultimately what we're coming back to. Understanding why dogs and cats behave the way they do is going to set them up to be successful. And then finally, we have a better buy-in that way. So the next steps are going to be, what are some of the contributing factors? So then finally, once we've kind of talked about the why and the how, we get into normal species-specific behaviors. So being able to read lower level body language, stress signals, and as a human, effectively communicating with my animal is going to be extremely important. Once that's out of the way, that first session, we're also going to talk a lot more about management tactics. So management is basically controlling the environment to prevent the unwanted behavior from happening in the first place. Ultimately, it's about working smarter, not harder. Find ways around it. But the big takeaway from management is we're not actually fixing the problem. We're really just trying to make life easier in the short term. Finally, we're going to develop a better emotional baseline. So here's some basic examples. With reactivity, we can avoid walks, go at quiet times a day. There are often medical influences that might not be causing the problem, but are at least influencing it. So I want you to think of me as sort of your personal behavior specialist or behavior technician. These are some of the things that I might be doing to help out. If after my conversation I think, this really seems to have a pathological problem, then I'm going to come back to you as the doctor and say, hey, look, this is what I think, this is why. And then at the end of the day, you're the doctor, you decide what makes the most sense for your patient. I might also pre-write your letter to the client because I know your time is limited. It's really easy for me to just give you here's the paragraph blurb. You can just copy and paste this and email it to your client. You signed off on it, we're done. And then I can also act as your clinic's primary point of contact for behavior-related questions. So the only difference here is that rather than me working for just your clinic, I work for multiple. All right, so before I see your patients, I do really want to know what your preferences are about my medical discussion. To that end, I have a Google form that you can fill out to give me an idea of what you're comfortable with me going over and what I'm not. So ultimately, this document just gives me an idea of what do you want me to talk about? Do you want me to talk about nothing? Do you want just kind of a general overview? Did you already prescribe products? Then you just want me to go into a bit more detail about how they work and the timeline and when we need to reassess. Once you and I have kind of established what our relationship looks like, what I do is sort of give them a vague overview of if we were to go this route, this is kind of what it looks like. And then from there, they have instructions to reach out to you directly, and the two of you talk about whether medical therapy is warranted in this case. So just as a quick overview, again, the initial consultation, it's really a lot about education. I might give them some immediate action points like stop hugging the dog, things that are going to help improve the situation pretty quickly. But ultimately, that training and behavior modification is going to come later down the line. We'll be kind of reviewing these different aspects of the behavior therapy. And you can see behavior modification and medication management are sort of at the bottom of that list. All right, so then we move on to after the consult. So I put together two documents. The first one is going to be the discussion summary, which outlines everything for the client. But then I also write a veterinary referral letter to you in particular. The owner is going to have at least a couple weeks to sort of implement some of these recommended changes. In the discussion summary, they're going to have their homework. They're going to have some graphics. I'm going to ask them to get certain pieces of equipment. Finally, we have our first follow-up. Depending on the case, I usually meet with them within 2 weeks. We can come back and say, all right, what are your immediate questions? Where are you struggling? What can I do to help? A lot of the times in the early days, it's virtual. I don't need to see you in person. Let's build some behaviors and safety and all that good stuff into your lives, and then we'll start working on the actual behavior modification. All right. And now we're getting into who can actually benefit from these services. You already know these animals. According to a study from a few years ago, 10% of new puppies already displaying behaviors outside the normal range. And so with kittens, it's probably even higher. I recently did a clinical rotation, and I swear at least 75% of the animals that I had contact with had behavior problems. So what are some specific examples? So with puppies, we can talk about house training, crate training, leash walking, mouthiness, inappropriate play, jumping up, chasing the kids, chasing the cat. Kittens then, on the other hand, we might have nighttime play, rough play, attacking legs. Maybe they're having a hard time integrating with the adult cats that are already in the household. We can talk about that. If we get into adult dogs, we might start developing some leash pulling and reactivity. Do they have separation anxiety? The owners can't leave them home by themselves without destroying the crate. And then finally, with our cats, I want to say the three most common behavior problems with cats. The first one is inappropriate elimination. So they're not peeing and pooping in their litter box they're supposed to. There's some sort of conflict between themselves and other cats within the household, which is insanely common. Aggression towards people in the household. And that can come in a lot of different forms. And sometimes you really, really need to look for it because a lot of people don't want to speak up about behavior problems. And so I would say at least 50% of your patients could benefit from behavior counseling. And then at least 10% of all your patients need help. Other services. So yes, the majority of my role is helping clients and families with pets, but I can also help your team too. Do we want to have a conversation about fear-free principles and techniques? Maybe your practice has a lot of really fearful and aggressive animals, and quite honestly, it's dangerous to work with some of these. How can we make that safer and more effective? We can also talk about specific behavior problems. I can also put together handouts and materials for your clinic. And then finally, we've got some other client resources. So ultimately, next steps, we can schedule a meet and greet where basically I'm going to come in and I'll give you guys some of those cards, brochures, any other material that you want. I can sit down with doctors in management. We can talk about this in a bit more detail. You can use the link in the description below and you can just go ahead and schedule your meet and greet whenever you want to. So ultimately, my goal is to help you and your patients. Think of me as your personal behavior specialist or behavior technician. So don't forget to go ahead and schedule that clinic meet and greet and using the link below, and we can chat more about those options. Thank you so much for your time, and I really look forward to working with you.